Hi, it's Dr. Greg Morris from the Ultimate Foot Store on Talking Feet. Today I'm going to discuss a problem I see in the office a lot is ingrown toenails and toenail fungus. And so first of all, ingrown toenails, I see at least 2 or 3 people every day for the last 25 years of ingrown toenails. And for such a small little problem, it can be amazingly painful. So what happens is on the toe, some people's toenails are just wide and they kind of dig into the skin, or people have like these curved nails, they've damaged their nails over time. And so the nails is digging into the skin, causing it to become inflamed. And it becomes very painful. And then as that nail digs into the skin, it can become infected, it becomes even more painful and swollen. And once that skin is swollen up, the nail digs in further and further. So if you catch an ingrown toenail early on, a lot of times on your own, you just cut that little edge of nail back and then soak in some warm water, with a little salt in the water, table salt, Hawaiian salt. Soak it every day for like 10-15 minutes and then put like a little Neosporin or any kind of topical antibiotics and a Band-Aid on it. But the toenail becomes increasingly painful or infected, develop what we call paronychia. Then I do a simple procedure in the office at least 2 or 3 times every day where I numb the toe up like a dentist shot and make the toe nice and numb. And after it's numb, I just take a small edge of nail out of there. And even when these toenails come in really nasty, infected, as soon as that nail comes out of there, it's like taking a splinter out. You get instant relief in your pain, but also infection. Rarely do I have to prescribe antibiotics once that little edge of nail is removed. And if it's the first time it's happened, we just take that little edge of nail out of there and let the infection resolve. If patients continue to have ingrown toenails over and over again, or they have really dystrophic or misshapen toenails, then I'll do the exact same procedure. Now after I take that little edge of nail out of there, I'll put a little medicine back there to kill that edge of nail. So now the toenails have been permanently a little bit skinnier, so people don't get ingrown toenails ever again. And it just takes a little longer to heal. So if it happens over and over again, we do that same little procedure where I burn that, we call a matrixectomy, where I remove part of that nail permanently. And then you just gotta soak it. It just takes a little bit longer to heal, but then that edge of nail won't grow back and the toenail will flatten out and be much better. Another problem with ingrown, besides ingrown toenails, is having toenail fungus. And a very large portion of people in Hawaii have toenail fungus. We live in the tropics. And we also damage our toenails a lot because we go barefoot a lot, we wear slippers. And fungus, there's fungus all over the ground. It's the same fungus that causes athlete's foot. It's all over the ground, but it's hard to get a nice healthy nail. But we damage our toenails. We kick something, we drop something on our toes, we stub our toe, and we damage our toenail. So anytime you damage your toenail, trim back any part of the nail is dead. We want nice, healthy pink nails. That naturally fights off the fungus. When a toenail is damaged, that's when the fungus gets in there. And once you have fungus in your toenails, it becomes severely thickened over time or discolored. It can also cause ingrown toenails because the toenail becomes misshapen, and it's very difficult to get rid of it. And once it's in one toenail, good chance it's going to spread to other toenails or cause you to get athlete's foot over and over again. So if you have discolored toenails, thicker, crumbly toenails, you probably have fungus in there. And it's very difficult to get rid of, but the best thing is cut away all that thick toenail. If you have a hard time cutting it, patients come in, I cut that thick, chunky toenail back, or if it's really bad, you numb you up, take the toenail off of there. And then there's all types of over-the-counter medication you can try using. What I've found over the years that works the best is good old-fashioned Vicks Vapor Rub. The stuff you rub on your chest for coughs and colds. It works great for toenails. It softens the toenails, kills the fungus. Just a very small amount of Vicks on there. Once a day is good, twice a day is even better. If you're worried about it wiping off, put a Band-Aid on or a pair of socks on there too. But if you keep the toenails cut back or trimmed back or filed back and use the Vicks consistently, it typically takes care of the fungus. If the toenails are really bad, it's not getting better, then we also prescribe an oral medication. And if any kind of medication, there's always a chance of side effects, so we try things topically first. But if it gets worse, then there's also, combined with the topical treatment, we give an oral medication called terbinafine or Lamisil, and that's very effective also. So once again, if your toenail is getting ingrown, trim it back and soak in some warm water or use some antibiotics. But if it starts getting painful or infected, come and see me. I'll take care of it right away for you. And if the toenail is getting thicker, discolored, or crumbly, keep them trimmed back and try good old-fashioned Vicks Vapor Rub. And if it's not getting better, come in, we can do some other options for you. So once again, Dr. Greg Morris at Ultimate Foot Store at Talking Feet. So we'll see you next time.